Interferons are a signaling protein produced by host cells, mainly white blood cells, in response to viruses, bacteria, and tumor cells. They act as an immune system communicator that trigger antiviral, antiproliferative, and immunomodulatory effects to fight infections. There are three main types of interferon, which is type 1, type 2, and type 3. The first interferon is type 1 interferon. They are produced by virus-infected cells and fibroblasts. Their members are leukocytes and fibroblasts. And then their receptor are IFN-AR1 and IFN-AR2. Their function are to induce an antiviral state, activate NK cells, and to increase MHC class 1 expression to enhance antigen presentation. They are also used to treat viral infection and also cancers. The second interferon is type 2 interferon. They are also known as immune interferon. They are produced by activated T cells and NK cells. Their member is IFN gamma and their receptor is IFN-GR1 and IFN-GR2. They are essential for macrophage activation, enhancing antimicrobial responses and regulating Th1 cell differentiation. They are also used to treat chronic granulomatous disease. So the last interferon is type 3 interferon. So this interferon recognized as most recently discovered drug that acts similarly to type 1 but more localized to epithelial cell. Some of their members are IFN lambda 1 and IFN lambda 2. Then they will bind to a receptor complex of IFN-LR1 and IFN-R2. Then their function is to provide antiviral protection at mucosal barrier to reduce inflammatory side effect compared to type 1.
Interferons are important proteins that used in antiviral and anti-cancer therapy, but how they are produced in a large scale? Let's go through the process step by step. Firstly, the scientists identify the interferon gene from human cells such as leukocyte or fibroblasts. Then the gene is isolated by extracting the mRNA and converting it into cDNA. This is because cDNA is more stable and suitable for cloning. Next, the interferon gene is inserted into a plasmid vector. The plasmid contains a strong promoter for high protein production, selectable markers like antibiotic-resistant genes, and regulatory sequences for proper gene expression. This step uses the recombinant DNA technology to combine the DNA from different sources. Then the recombinant plasmid is introduced into a host cell, commonly E. coli. This process is called transformation and can be done by using the electroporation or heat shock. Only the cells that successfully take up the plasmid can survive in the antibiotic-containing media. These cells are now genetically modified to produce interferon. Inside the host cell, the interferon gene is expressed. The DNA is transcribed into the mRNA, and then the mRNA is translated into the interferon protein. In bacterial system, the protein usually remains inside the cell, but in mammalian system, it may be secreted and properly folded. The genetically modified cells are then grown in a large bioreactors. Conditions such as pH, temperature, nutrients, and oxygen supply are carefully controlled. This allows efficient and large-scale production of interferons. Next, the interferon is harvested. If the protein is inside the cells are broken open to release it. If it is secreted, it can be directly collected from the culture medium. After that, the interferon protein is purified using the techniques such as filtration and chromatography. This process is to remove the impurities, host cells protein, and also the harmful substances such as endotoxin. Purification process is essential to ensure the product is safe for human use. Finally, the purified interferon is sterilized and formulated into pharmaceutical products, usually as injection. Stabilizer may be added into the product to maintain its activity during the storage.
We'll be going through the anti-cancer applications of interferon. First, let's look at hematological malignancies, which are cancer of the blood. For example, hairy cell leukemia and chronic myelogenous leukemia. The interferon used here is interferon alpha. It is used to induce remission and slow down the proliferation of abnormal white blood cells. Then in malignant melanoma, the interferon used is high-dose interferon alpha. It is given as adjuvant therapy after surgery, and it is to reduce the risk of recurrence.
One major application of interferons is in treating chronic viral hepatitis, including hepatitis B and C. Interferon alpha and alpha-2b are the common drugs that used for the treatment. It can help to reduce viral replication, limiting the amount of virus in the blood, so that liver cells are protected from progressive damage and inflammation. This application also helps prevent long-term complications such as cirrhosis and liver failure. For the second important application of interferons is in viral-related neurological conditions such as multiple sclerosis. In this case, interferon beta is applied to reduce inflammation in the nervous system and modulate the immune response to prevent autoimmune attacks on nerve. And lastly, interferons also plays an important role in emerging or adjunct viral use, such as in COVID-19. In this application, interferon alpha or interferon beta is applied to boost early antiviral immune responses, activate immune defenses more rapidly, and potentially reduce disease severity while limiting virus spread during the early stages of infection. So all these interferons are commonly administered via parenteral routes, particularly through subcutaneous or intramuscular injections, as they are protein-based drugs that would be degraded if taken orally.
Interferons play an important role in treating diseases. They are used to treat viral infections like hepatitis by stopping viruses from multiplying in the body. They are also used in cancer therapy, where they slow down the growth of cancer cells and help the immune system attack them. As a result, patients are able to manage their conditions better and, in many cases, live longer. The benefits of interferons also extend to society. They increase life expectancy, especially for patients with serious illnesses. They help reduce the spread of infections, protecting communities. And most importantly, they improve quality of life, allowing patients to live more normal and productive lives. Interferons also environmentally friendly. They are produced using biotechnology, often with microorganisms like bacteria. This method is more controlled and precise, and it's produced less chemical waste compared to traditional methods. However, interferons do have limitations. They can be expensive, making them less accessible to some patients. They may also cause side effects such as fever, fatigue, and also depression. Despite this, interferons remain a powerful tool in modern medicine, improving lives and shaping a healthier future.
So now, let's move on to some recent advancements in interferon therapy. First, we have pegylated interferons. This involves attaching a polyethylene glycol or PEG molecule to interferons. So, what does this do? It actually increases the half-life, meaning the drug stays longer in the body. Because of that, patients don't need frequent injections. For example, it can be given once weekly instead of multiple times. It also improves stability, so the drug is less easily degraded, and overall we get more sustained drug levels, which improve effectiveness. So next is targeted interferon delivery. Here, the idea is to deliver the drug directly to the specific target size. This leads to higher drug concentration at the target area while reducing exposure to the rest of the body. As a result, there are fewer systemic side effects like flu-like symptoms and fatigue. Next, we have combination therapy. This means using interferons together with other treatments. For example, interferons can be combined with antiviral drugs, chemotherapy, and immunotherapy. This main benefit here is the synergistic effects, where the combined drugs produce a stronger response than when used alone. This approach can also reduce drug resistance, which is a major problem in long-term treatments. Ultimately, combination therapy leads to better clinical outcomes for patients.
Lastly, personalized medicine. This moves approaches one-size-fits-all model by using genetic testing and biomarkers to predict how a specific patient will respond to therapy. Because of genetic differences in immune response or drug metabolism, some patients naturally respond better to treatment than others. By identifying these differences early, doctor can select the patient most likely to benefit, tailoring the therapy to the individual. This is not only improve the treatment success but also helps patient avoid unnecessary side effects and that might harm them. By combining the natural production power of gene engineering, recombinant DNA, or personalized medicine, we are entering a new era of highly effective and patient-focused interferon treatments.